Ever wondered why some men struggle to maintain an erection? It's a question that many ponder, and the answer lies in a condition known as erectile dysfunction, or ED. This term refers to a situation where a man consistently finds it challenging to achieve or maintain an erection firm enough for sexual activities. Now, it's important to differentiate between the occasional difficulties and persistent problems. Everyone can have off days where things don't work as expected, and that's perfectly normal. However, when these difficulties become a regular occurrence, it's time to pay attention. Persistent erectile dysfunction could be a sign of underlying health issues that need addressing. It's not just about sexual performance, but about overall health and well-being. So it's crucial to take persistent issues seriously and seek help when needed. Remember, occasional troubles are normal, but persistent issues could be a sign of something more serious. So, what causes erectile dysfunction? There are several factors that can lead to erectile dysfunction, and they can be broadly categorized into physical, psychological, and lifestyle factors, and certain neurological conditions. Let's start with physical factors. Conditions such as cardiovascular diseases, diabetes, high blood pressure, and obesity can all contribute to erectile dysfunction. These conditions can affect blood flow and nerve function, both of which are essential for achieving and maintaining an erection. Hormonal imbalances, too, can play a role. For example, low testosterone levels can lead to decreased sexual desire and ED. Additionally, certain medications can lead to erectile dysfunction. These can include drugs used to treat high blood pressure, depression, and even some types of painkillers. Substance abuse, including the use of alcohol and recreational drugs, can also contribute to ED. And lastly, surgeries that affect the pelvic area or spinal cord can sometimes cause erectile dysfunction. Now, let's talk about psychological factors. Stress, anxiety, depression, and relationship problems can all lead to or exacerbate erectile dysfunction. The mind plays a significant role in sexual function, and your emotional well-being is closely tied to your sexual performance. Lifestyle choices can also contribute to ED. Smoking, for instance, can damage blood vessels and decrease blood flow to the penis. Excessive alcohol consumption can also lead to ED. Furthermore, a sedentary lifestyle and poor dietary choices can lead to conditions like obesity and high cholesterol, which in turn can lead to erectile dysfunction. Finally, certain neurological conditions can also lead to ED. These are conditions that affect the nervous system, like multiple sclerosis or Parkinson's disease. They can disrupt the brain's communication with the body, leading to erectile dysfunction. In short, the causes of erectile dysfunction are many and varied, and they often overlap. It's not uncommon for a man to have multiple contributing factors. That's why it's so important to talk to a healthcare provider if you're experiencing ED. They can help identify the underlying causes and guide you towards the most effective treatment. Understanding the cause is the first step towards finding a solution. How do you treat erectile dysfunction? This is a question that weighs heavy on the minds of many. The good news is, there are a variety of treatment options available, each catering to the unique needs and circumstances of each individual. Let's start with lifestyle changes. The importance of a healthy diet and regular exercise cannot be overstated. These two factors play a significant role in maintaining overall health and well-being, and they contribute substantially to sexual health too. A diet rich in fruits, vegetables, lean proteins, and whole grains, coupled with regular physical activity, can do wonders in improving circulation, boosting energy levels, and enhancing mood, all of which can positively impact erectile function. But what if lifestyle changes aren't enough? That's where psychotherapy and counseling come in. If the root cause of erectile dysfunction is psychological, such as stress, anxiety, or relationship problems, talking to a mental health professional can be incredibly beneficial. Therapy can provide a safe space to express and navigate through feelings, identify underlying issues, and develop effective coping strategies. It's not just about addressing the symptoms, but tackling the source of the problem. Now let's delve into the world of medical treatments. Medications like Viagra, Cialis, and Levitra have revolutionized the treatment of erectile dysfunction. These drugs work by increasing blood flow to the penis, making it easier to achieve and maintain an erection. They've proven to be effective for many men, offering a practical and convenient solution. However, it's crucial to remember that these medications are not a one-size-fits-all remedy. They're not suitable for everyone, and they come with potential side effects. Plus, they're not instant magic pills. They require sexual stimulation to work. And most importantly, they should never be taken without the advice and supervision of a healthcare professional. So, whether it's through lifestyle changes, psychotherapy, or medication, there are several ways to address erectile dysfunction. The key is to find the approach that works best for you and to always seek professional guidance. Remember, medication should always be taken under medical supervision. Besides medication, what other treatments are available? Let's delve into the alternative solutions to erectile dysfunction. Non-invasive treatments like vacuum erection devices are a promising option. These contraptions work by creating a vacuum around the penis, which draws blood into it and facilitates an erection. They're a great choice for those who wish to avoid medications or invasive procedures. However, it's important to note that they do require some practice to use effectively. With patience and persistence, many men find them to be a useful tool in managing erectile dysfunction. If oral medications and vacuum devices don't provide the desired results, it may be time to consider more direct treatments. This is where penile injections and urethral suppositories come into play. These treatments involve delivering medication directly to the penis. Penile injections are administered into the erectile tissue, while urethral suppositories are inserted into the tip of the penis. These methods can be highly effective, but they are typically considered when other treatments prove ineffective. Finally, for those who do not respond to other treatments, surgical options may be the way forward. Penile implants offer a lasting solution to erectile dysfunction. These implants involve the insertion of either inflatable or semi-rigid rods into the penis. The result? The ability to achieve an on-demand erection. This procedure, although invasive, has helped many men regain their confidence in sexual function. Remember, the journey towards managing erectile dysfunction is personal and unique to every individual. What works for one person may not work for another. It's all about finding the right fit for you. Consult with your healthcare provider, discuss your options, and make an informed decision. In conclusion, while erectile dysfunction can be a challenging issue to navigate, there's a plethora of treatment options available. From non-invasive devices to direct treatments and surgical options, the best course of action depends on your unique situation. There are many treatment options available, and the best one depends on the individual's unique situation. So, what's the takeaway here? Erectile dysfunction, or ED, is a common issue that affects men of various ages. It's a condition that can have both physical and psychological causes, be it cardiovascular diseases, diabetes, stress, anxiety, or even lifestyle choices like smoking and poor diet. But remember, it's not a condition to be ashamed of, but rather one to confront head-on. ED is treatable and numerous options are at your disposal. Lifestyle changes, psychotherapy, medications, and even medical devices can help manage and overcome this issue. Importantly, it's crucial to understand that occasional difficulties in maintaining an erection are normal. But if it becomes a persistent issue, it's indicative of an underlying problem and should be addressed. Never hesitate to seek medical advice. Remember, every problem has a solution, and erectile dysfunction is no exception.